Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Lung cancer is one of the leading causes of death in the United States, and that makes early detection so important for better outcomes. So we're talking with family practitioner Linda Salem about that today. Thanks for being here.
Thank you for having me.
Yeah, there's so many people that need to be aware and have this on their radar. Who is the most at risk and should be considering a lung cancer screening, or should this kind of be standard practice for just about everybody?
Mainly people that have smoked or are currently smoking, especially people that are older, over 60 are more at risk. Men are more at risk. If you've had environmental exposures, like some people where they work, as we were also talking before, it can also be sometimes a hereditary type thing. But the main thing for our screening right now is usually the smokers.
The smokers. What if you're not a smoker but have been in contact with a lot of secondhand smoke, someone you know and love, smokes around you quite frequently, from kids to adults?
That can be an option. It also depends upon your insurance on what they will cover. I mean, we can offer screenings, but also it kind of depends on that. The main thing for right now, it appears that it's more aimed towards the smokers.
Okay. Tell me about what this screening process looks like. Is there a certain age you should start?
Usually the recommendations now are 60 to 80. Male or female, anyone who is a current smoker or a previous smoker that has quit smoking within the last 15 years.
Okay. And how does the screening work? Do you need to set up an appointment? Is it sort of a walk-in thing? What's the process look like?
Usually you're coming in, you're talking to your primary care provider, you're doing your annual health screenings, maybe just talking about what your risks are. And then if you qualify by going to all the risks that you may have, then we usually will set up, it's called a low-dose CT scan of the chest.
Okay, and what kind of test is that if people aren't familiar with it?
It is a CAT scan or a CT scan. It's low dose, so you don't have to have any type of an IV or contrast media or anything like that and it just looks at the lungs and sees if there's any mass or suspicious looking areas.
Are there limitations for the lung cancer screening process?
All tests, there can be false positives and false negatives on any test that you do, but generally speaking, it's a fairly good screening tool. And if there is something suspicious looking, then we would do further testing, like with PET scan, or more of a contrast CT, more of a diagnostic. Right. This is just a screening.
Right. What would you say to somebody who feels like, you know what, I mean, I'm a lifelong smoker, but I'm really not having any issues. I don't even need to worry about this.
I really encourage them to do it because when we detect things early, we have more options. You know, it's easier to treat. I have a lot of patients who do that. They say, I just don't want to know.
Right.
And that is kind of hard to address. I mean, you can't make anyone do a screening if they don't want to do it. But I have seen by doing these screenings that we can detect things early and make it treatable and a lot less of a serious situation.
Yeah, too early, so you have the best prognosis for being around for your loved ones. Sure. Yeah, that's for sure. You mentioned insurance coverage before. If you fall on those parameters, does insurance most likely cover this?
Most likely does cover it. Medicare does cover it 100% with your Medicare wellness screenings. Any male or female that is 60 and over, so if Medicare, usually you're 65. If you have been a smoker, usually it's about a 20-pack a year, which means that you've average smoked half a pack a day, and have quit smoking within the last 15 years, you can still be eligible.
Okay, so something for those who like to smoke and have had that lifelong habit to think about. We all want our loved ones to stay around as long as possible.
Exactly.
All right.
Exactly.
Linda, thank you so much for being here. We sure appreciate it.
Thank you.
Thanks for checking in on Monday Health Minutes.